Dr. Hajjal, sleep apnea has been getting a lot of print lately. Is it an old condition or is this something new?
Well, it's an old condition. I mean, everybody knows, our grandparents or great-grandparents snoring when they're sleeping.
Like thunder, yeah.
Exactly. The difference now is that we have a treatment since the mid-'80s or so, early '80s. We have a treatment that can cure the sleep apnea. It's become much more relevant recently because we know it's associated with significant disease and could cause mortality of the person who snores. Now, of course, the disruption of sleep and being sleepy during the day could cause mortality of other people if that person gets behind the wheel of a car. But it's important because it helps, sleep apnea can affect the functioning, the productivity of the person. So in case you're running a business, it's important to get that treated. But it also affects the personal health by raising the blood pressure, causing more irregular heart rhythms, heart attacks, or even stroke. Have all been linked to sleep apnea within the last few years.
So there's
and now
some
we
real
know the
health
treatment
risks.
is important.
Yes.
Absolutely.
You explain exactly what's happening.
What happens is that there is an area behind the roof of the mouth and behind the tongue that is very weak. In a way, it's protected by muscle. And what happens is when we sleep, our muscles relax completely, and they would end up getting a little bit narrower, making the noise when the air moves. That's the snoring part, which is fine in of itself. It's not disrupting the sleep. But when the snoring starts disrupting the sleep, this is what we call an apnea. And it could be an apnea, true one, when the airway collapses completely and the person is not breathing. So go and then snore. Or it could be a loud snore where the person have to make an effort just to get the air moving. And that is also part of the apnea problem, and it's called hypopnea. So anything with the snoring that starts disrupting the oxygen, the heart functioning, or the brain functioning is called the sleep apnea.
Can you be a snorer without having sleep apnea?
That's true. And people can, of course, when you are a snorer and don't have sleep apnea, it could be that you're going down that path, and 20 years down the road or 20 pounds down the road, you could end up having sleep apnea. But we do find some people who just are snorers without having sleep apnea, absolutely.
How about the reverse of that? Could you have sleep apnea and not be a snorer?
It's rare to have apnea without being a snorer. It's quite rare. You would have to have so much disruption of your sleep that you think that you're unable to fall asleep. Or sometimes when people have surgery on their upper airways, they would end up having apneas and the disease without having so much snoring.
Oh, I see. What are some of the symptoms of apnea?
Of course, the symptoms are three. One is would be the snoring. So your bed partner will come in, and they usually describe the apnea. Sometimes they describe it so well, we love them for it because they give us the diagnosis. Number two is the fatigue and tiredness during the day. People say that they are in a fog, unable to be productive, unable to drive, unable to function during the daytime. Number three would be if they have any medical conditions that could be associated with that. Number one being obesity, and of course the cardiovascular problems or diabetes, and then those could be manifestations of the sleep apnea.
So obesity has an effect on sleep apnea?
Absolutely, because it makes the neck a little bit heavier. Both men and women, when they gain weight around the neck size, and it makes it a little bit heavier, which means more reason for the airway to collapse and cause trouble with the breathing.
And you stop breathing during the night?
Yes, when we do the test, some people are amazed, but we don't even count that you have sleep apnea if you quit breathing 5 times or less. So we're talking about people who quit breathing 15 times, 20 times. I've seen people more than 100 times an hour. An hour of sleep, right? So you can imagine the quality of their sleep, how that's going to be.
But they don't realize it when they get up in the morning?
Well, most of the people, when they come here, they say, yeah, I know I've been snoring for 10 years, but I thought I'm getting older, or maybe when I lose a little bit of weight, it'll be better. And people put it off so much. And there's also lack of awareness. I find that even if they discuss it with their physician, it doesn't ultimately lead them into the sleep lab most of the time. And those people end up showing up because they're fatigued and tired. They get misdiagnosed with depression or other things, thyroid disease, before they get diagnosed with sleep apnea.
Because fatigue during the day could be from a multitude of reasons.
That's true.
And if you check your thyroid and you take antidepressants and you're still feeling fatigued,
Right,
and you snore.
I say even before you take the antidepressants, maybe it's a good idea to discuss about the sleeping pattern. It shows up in very subtle things like men's erectile dysfunction is linked to that, and in women the muscle aches and joint pains could be linked to that as well. And so there's a whole host of diseases that I think physicians are not frequently asking about their sleeping pattern and their snoring before they label with the other diagnosis.
Well, thank you very much.
Thank you.